Hello, I'm John Fanburg, managing member at Brach Eichler and chair of the firm's healthcare law practice. For more than 40 years, I've had the privilege of advising physicians, healthcare institutions, and private equity groups on complex healthcare transactions, regulatory matters, and strategic business planning. Today, I want to share insights into what it means to sell your medical practice in today's evolving healthcare landscape, including what to expect, what to avoid, and how to protect what you've built.
Selling your practice to Wall Street, Part 2 of 3. What's your practice worth? The trade-offs, valuation, and growth potential.
A selling physician must also understand that as an employee in the new model, the physician may not be able to generate the same level of compensation that he or she earned in his or her own private practice. Because the acquiring entity bears the risk of the investment, it also reaps the rewards. Such physicians must accept that they will no longer be compensated as partners of the practice, but instead will be retained as fixed salaried employees or reimbursed on a per RVU basis for a certain period of time. Another benefit is that the physician is no longer responsible for the overhead associated with running a private practice. Such physicians do not need to allocate resources toward rent, payroll, supplies, marketing, etc. Their only concern is maintaining their patient relationships and providing high-quality, cost-effective care. By reallocating their focus, selling physicians may be better positioned to improve patient care. While it certainly means fewer headaches, it also means reduced autonomy in the management and day-to-day affairs of the practice. Physicians who once controlled every aspect of their practice soon learn that as employees, they have very little say over management decision-making. While some aspects of control are negotiable terms in a transaction, selling one's practice may still require an adjustment period for those physicians who have grown their practices. It is not always an easy transition from owner to employee. An important benefit of selling a practice is the increased resources that a hospital or perhaps a PE firm can provide to a physician's patients. With healthcare shifting from reactive medicine to improved preventive care, access to a wide range of resources can significantly improve patient care. For the physicians personally, the buyer fully subsidizes certain employee benefits. For example, as an employee, a physician is not required to purchase his or her own malpractice coverage. Depending upon a physician's specialty, such savings can be quite substantial. Of course, just as with the management of a practice, physicians should remember that as employees, they have very little influence on the type of benefits that they are afforded. For the physicians personally, the buyer fully subsidizes certain employee benefits. For example, as an employee, a physician is not required to purchase his or her own malpractice coverage. Depending upon a physician's specialty, such savings can be quite substantial. Of course, just as with the management of a practice, physicians should remember that as employees, they have very little influence on the type of benefits that they are afforded. Now let's talk about determining the valuation. In making the decision to sell one's practice, an important consideration is the valuation of the practice. Publicly traded or venture capital-backed practice groups primarily seek a superior return on investment. The specific purchaser may have an interest in healthcare services and even more specifically in the target group specialty. Unlike, however, a sale of physician practice to a hospital or another privately held physician group, which may take into account community relations, professional expertise, and certain other goodwill considerations, Wall Street acquisitions are typically driven by the valuation of the target practice and the financial return the transaction will provide to its investors. From the purchaser's standpoint, there are 3 critical points of analysis, which are often intertwined. This helps determine if they will complete a transaction and what they want to pay for the physician practice. Quality of earnings, synergy, and scalability are the key components. Quality of earnings focuses on how likely it is that the target practice's profits will continue after its acquisition. Factors affecting quality of earnings include whether the target group has long-term referral arrangements in place, dominates its geographic market, and expects third-party payer reimbursement to increase. Synergy revolves around the degree to which costs and expenses can be eliminated or revenues increased in the target practice through a merger with the purchaser. Potential purchasers will analyze how administrative costs can be reduced, medical malpractice rates improved, and if a stronger negotiating position will impact reimbursement from third-party payers. Scalability addresses whether or not the revenues of the target practice will grow due to its acquisition by the institutionally financed practice group. For example, potential purchasers will analyze whether the transaction would increase the likelihood of the target practice acquiring additional local practices, obtaining new contracts, opening an additional office locations, offering a wider range of services, or retaining more referrals. If the stars line up, a purchaser will be able to cut the target practice's costs, improve reimbursement, and increase revenue. If all of these things do happen, the purchaser is in a position to pay more for the practice in the form of cash, salaries, bonuses, stock, or rollover equity. Often, however, all of the stars do not align and a valuation compromise must be reached. Thank you for taking the time to join me. If you're a healthcare provider considering a sale, merger, or new partnership, it's essential to make informed decisions backed by experienced counsel. At Brach Eichler, we're here to help guide you through every step of the process. If you'd like to connect, feel free to reach out to me directly at 973-403-3107 or by email at jfanburg@bracheichler.com. You can also learn more at www.bracheichler.com, and I look forward to hearing from you. Be well.
Thanks for watching part 2 of our Selling Your Practice series with John D. Fanburg. Don't miss part 3, Avoiding Pitfalls When Selling Your Practice, Legal Risks and Key Takeaways. Click the link in the description to continue.